My name is Natalie Doyle. I'm the nurse consultant for Living With and Beyond Cancer at the Royal Marsden, and I'm going to talk to you today about personalised care and the elements of that package that you might expect during your cancer experience. When somebody's diagnosed with cancer, it's really important that as healthcare professionals, we don't just consider what's the matter with you and how that might be treated medically. It's important that we think about what matters to you as well, what you think as a person, what your priorities are, and what your current life situation is. Choices you make should be facilitated and supported by healthcare professionals. You may have your own personalised healthcare budget, or you may need to access services in the community. At this time, Macmillan's 10 Top Tips brochure may help you to plan how best to work with your healthcare team. There are 4 interventions that you should expect to receive during your cancer experience. And the first is a holistic needs assessment, sometimes called an H&A, which is a process that you would undertake probably with your clinical nurse specialist or your key worker, and it should be done probably twice during your experience. With the first holistic needs assessment, it's important that you have the opportunity to raise any concerns that you may have about what's happening in your life that will affect your ability to have treatment or to attend the hospital regularly. The other key time you would expect to have a holistic needs assessment is as your hospital-based treatments come to an end, and you're more likely to be accessing support in the community than you are in the hospital. It's important on both of these occasions that you feel that you can raise anything that's important to you and matters to you. This is about what concerns you as the individual with cancer and not what concerns the healthcare professionals. You would also expect to receive health and wellbeing information and support. This information might be delivered to you in one-to-one conversations, or you may be able to attend health and wellbeing events where you meet other people with cancer and have access to various healthcare professionals. It's a good opportunity to think about being more physically active or looking at your diet, and we're all here to support you during this time to make those changes. Another intervention that you should expect to receive during your cancer experience is a treatment summary. When you've completed the hospital-based components of your treatment, you and your GP and primary care team should expect to receive a summary from the hospital of your diagnosis and all the treatment you've received. This summary should also say what to expect in the future, that's signs and symptoms to look for that need to be reported to the medical team quickly. You and your GP should also be told about any tests or investigations that you may need to have, where these are going to be done and who is going to arrange them. What's incredibly important with this document is that everyone can refer to it at any time and everyone will know exactly what the plan is. Lastly, everybody with cancer should expect to have a cancer care review. Some way through your treatment, your GP or a member of the primary care team will invite you for a cancer care review. During this, you will have the opportunity to talk about your concerns and the local plan for you, your friends and family as you move forward. The conversation may be informed by the treatment summary or the holistic needs assessment, or indeed the health and wellbeing advice or support that you've received from the hospital. Ideally, this will be in the context of an ongoing relationship with your GP and primary care team who know you and your situation the best. If you haven't received the interventions or would like more information, please do ask your clinical nurse specialist or an allied health professional or anyone who acts as your key worker, because we are all here to help and we do want you to be able to live your life as well as you can.